Hello, good afternoon. This is Dr. Aaron Rogers. I'm one of the ear, nose, and throat docs working with the Hearing Center, and my colleague.
Dr. Stacy Pickelman, the lead audiologist for Advanced Hearing Centers.
And we wanted to talk a couple of minutes about a very common complaint that I hear from my patients almost every day. And honestly, I experience myself almost every time I go out to a restaurant. And that is that when we go to these restaurants, especially very social, kind of noisy restaurants that might have an open floor plan, it's very hard to hear. So I have pretty good hearing by a standard hearing test. I can hear most things around the house and at work. But we go to a restaurant, I have trouble hearing the server or maybe the other guests at my table. Do you see patients with that same kind of complaint?
Correct. The number one complaint is hearing and noise, or the ability to understand speech or that conversation in the presence of background noise. The restaurants are a lot louder now than they were 20 years ago. A lot of the restaurants care about the ambiance, how the architecture is, the high vaulted ceilings.
I think they've all had consultants that say if the restaurant is noisy and big, you're going to spend a lot more money at that noisy and big restaurant than you will at a quiet little place. So they basically all try to make the restaurant experience a total social experience for us, which really is to the detriment of our own hearing in those places. Now, I think, though, that it's not only that. It's not only that maybe restaurant format has changed a little bit, but probably in your maybe late 40s and 50s and early 60s, you do start to have a little bit of early hearing decline, sometimes in the highest frequencies only. Some of those frequencies we don't even measure with a normal hearing test. It has to be sort of an advanced hearing test to pick it up. And as we get that little bit of outer hair cell loss with that early hearing decline, we lose some of our ability to filter background noise. Is that a good way to say that?
Yes. So the consonants, or what gives us our clarity of speech, is in those high frequencies. So in age-related hearing loss, those high frequencies is what starts declining first. And then I call it helping out the neighbors. The areas where you have the better hearing, they can't really help out those high frequencies and give you the clarity in a noisy situation because that area of our ear is trying to reduce that background noise.
I would say most of the time in patients who are kind of otherwise not struggling with hearing and not having any other noticeable hearing complaint, they will very commonly complain of hearing in noisy situations. And we can maybe pick up a little bit of that hearing decline on a hearing test. But most of those people, don't worry, you're probably not in the hearing aid zone yet. It's just something to be aware of. So just want to relieve some anxiety and some fear about that. I myself experienced that same phenomenon. Maybe Dr. Pickelman will too if she ever gets as old as me.
Maybe one day.
But it is something that we see all the time. It's nothing to worry about, but probably worth checking on hearing to make sure that our ears are hearing equally and make sure there's nothing else abnormal about your hearing pattern. All right, thank you. Feel free to give us a call whenever we can help at our office or our website. Thank you very much.
Thanks.